Today's subject is how I can guarantee high blood pressure. When you understand, behind the theory, then you will understand, why I could guarantee, this hypertension issue. Okay. Here is a heart. And this is a lower body, and this is the upper body, which is let's say this is the head. Okay. Now this one is artery, and this one is vein. Okay. Now obviously this is the artery, this is the vein too. Okay. So. Maybe this way, but I hope you understand, what it means. Okay. Now, when this is my heart, this is the blood. Now, if I just let this one boil down, usually what happens is ball come down, hit the floor, then come up. Then like this, then it goes to the flow. But sometimes when I hit with the force, which is the pressure, okay? When I hit, then come up, it's the same level. Come to over here. That is good for the heart. But if this one comes to up here, that is not good either. So the ball must come down, then come to same level. This is the fundamental principle. Now, when go to artery here, now the speed or velocity is that this is fast. And this is slow. So, whole problem is because of slow. When blood stream slow, then usually there will be blockage because of slow. When fast, then wash away. So far, Western medicine talk about, when it doesn't, we don't care much. Why? Because when blood does not go fast enough, then blood vessel expand, then stay there. So we don't worry about that. But when artery is blocked, then it is a risk of life. So artery, the blockage is important, but vein, we don't care much. That is a theory so far. But my, opinion is, no, this is slow over here. Here is the problem. So when we hear, when you talk about, this vein, then we know how to, handle hypertension easily. There are three portions I am going to explain. Okay. Now the ball come down. This is the flow. Okay. Then come down up to here. But it does not. It's not easy to go up. So. Let's say this is the leg, this is the foot, and this is knee. Then when you look at behind here, the calf area, then here is muscle called gastrocnemius. Now, one part is because of over there. Why? Because there are 1, 2, 3 valves here. What's the purpose of valve? Because it's difficult to going up. So that's why we have 3 valves in there where when I look at the internet all over while looking, I could not find the exact location of the valve. But a valve should be 1, 2, 3 somewhere here. But I could not find where the valve exactly. I don't know. But there are 3 valves here. That's my my guess. That is not exact one. Okay. Then second theory is our heart has a function. If anywhere there is kind of blockage or slow, heart try to make it open with pressure. That causes high blood pressure. So wherever you have a pain in the body, then take care of the pain. Then your blood pressure will be down. This heart, one more time, has a function. If there is a blockage, then they try to open the blockage with pressure. That causes high blood pressure. Now, third one is on the skin. We have a pain. We know that, I have a shoulder pain, neck pain right away because our skin has a lot of nerve. So when you have a pain, we understand right away. I have a pain on the neck or shoulder, things like that. But unfortunately, our liver, heart, pancreas, lung, kidney, or gallbladder, stomach, all those ones, there is very less nerve in there. Unfortunately, even though there is a blockage, we may be not able to realize there is blockage there. So, 3 parts. The first part is this part. Second part is the pain. When you have a pain, get rid of the pain, your blood pressure will be lowered. And so, sometimes, patients come over and we measure, a blood pressure. Let's say come to 180. Then I show, how to do exercise. And then, for this and the leg and things, then we measure again. Then it come to 162, 165. That's easy. 2/3 of patients find out this kind of a thing. Like, almost like, 10% down with just the exercise. This exercise I am going to introduce one by one. Then when I give acupuncture treatment, then I test again. Then you come to almost 140 to 150. Then patient told me, "Oh, it's so easy." No, it's not easy because you see good acupuncturist. That's what I said to my patient. So we are going to show all this kind of exercise and the treatment one by one. Okay, and this exercise and the other exercise it can be done by individual. And however, when you go inside matter, then you have to see the acupuncturist, okay? Thank you so much for your watching.